Respiratory. Hi, my name is Amy and I'm a respiratory care student, and today I've been ordered to do an ABG, okay? Now an ABG is, we are going to draw blood, but we are going to draw it from your artery instead of the veins, so we are going to take it from your wrist, okay? And before I begin, I just want to check to make sure your wristband matches with my documents here. So I'm going to check the name and date of birth of the patient. All right, perfect. It matches with mine. And so before I begin anything, I'm going to make sure my hands are clean before I assess the patient of vital signs, make sure everything is good before I begin. And I'm going to make sure the patient is setting up properly and is able to extend their arm out. So when I have the patient, I'm going to make sure they have something underneath them, either a towel, something that can hold their wrist, and they can bend it out for me. And when I do this, before I take anything, I need to do the modified Allen's test. So that is when I have block both of the radial and ulnar, and I'm going to have them make a fist 3 times and see how long it takes. And if it comes back negative, I have to do the other side to see how it does. So if it doesn't, the skin color doesn't come back in 3 to 5 seconds, then it's negative. All right, so before I begin, I'm going to make sure my hands are clean again. And then I'm going to put on the proper gloving. And like if I feel like I need to put a mask on, I'll put a mask on just in case. Shouldn't have any problems with blood splatters. But I'll prepare the site. I'll make sure I find where the proper site is. And when I do it, I'll take my alcohol prep wipe and I'll do circle motions around it. That way I have a clean sanitary area. And I need to make sure I have my gauze for when I'm done. And with this, and I also have my stopper, a Band-Aid for when the blood is done, and the patient's tag. I need to make sure the patient's name is on there and I have the proper date and time. So when I begin, I'm going to make sure I'm going to palpate the radial artery and make sure I find it, okay? After I find it, I am going to remove the cap off the needle, and I'm going to have it at the right appropriate thing, and I'm going to make sure the bevel is up when I go in. And so I'm going to hold it like it's a pencil at a 45-degree angle. So I'm going to go slowly up to there, and then when I'm ready, I can either move my finger away and the blood should begin to come into the tubing. And once I'm done, I would put it into the stopper, either the stopper and dispose of the needle, and I can remove that, and I can also on a gauze or something to remove any air bubbles, anything that's inside the needle that we don't want when we're doing the testing. So we will dispose of that, and when we are ready, we will put this cap on. We'll remove the needle and we'll put this cap on, and we will place our sample into our biohazard bag. We'll have to place it in there and make sure our label is properly put on there. And with the label, you want to make sure, so like if the patient is on like a Venturi mask, you want to write down the FiO2 of what the patient is on. So you write down the FiO2 of what the mask is on, so it'll always be the same of what the mask is at. So once I'm done, I'm going to make sure everything is disposed of, like the needles, my gloves, anything that may have blood on it, anything that can potentially contaminate any of the area. So with the patient, after I'm all cleaned up and everything, I'm going to reassess them. I'm going to double check their Venturi mask, make sure it's fitting properly to their face and they're comfortable. And then I'm also going to make sure the patient's vital signs are okay before I leave or anything. And I also forgot to mention, with the sample, if I'm not going to be able to leave right away, I need to put it on ice so that way it prevents it from clotting. And then I'm all done, they're okay, and then I can wash my hands before I leave the room.